we had a horrendous RSV season here in Houston. And I know that this year, like Texas Children's, they were very excited to offer the new antibodies, which now the CDC has said they need to reserve for, the very vulnerable population, which, they'll abide by. But does that just mean that it's going to be a really terrible season? Are we going to be able to get more antibodies soon?
Yeah, so I know parents are frustrated. For the first time ever, good news, we have this new shot to protect our babies, but it is in short supply. And I know that's really frustrating. We've been working with the manufacturer to get more of the new antibody out there and that new shot out there for folks. So I'd say call your pediatrician, ask if they have it, but then take the normal precautions you do with your babies to make sure that they're protected through the winter season. Again, stay home if you're sick, wash your hands, open a window, right? All those things that we know help protect folks.
Do we know that if we would get them, if you're working with the manufacturer, would we get them this season, or would it be not until next season?
Yeah,
possibly?
we're working to see more come out this season. So every day and week we see a bit more coming out. So I'd say call your pediatrician and see if they have supply.
Okay. And so are you predicting a really bad flu, COVID, RSV season, all of the above?
Well, the good news is we're right at the beginning. We're not seeing an early flu season. We're sort of seeing a typical season. We're starting to see an increase right now of flu. We're actually seeing COVID still come down from that summer wave we had earlier in the year. So right now is a great time to get vaccinated, get yourself protected ahead. But we also know Thanksgiving's coming up next week, right? And we know when we travel, that virus moves around more. So we do expect more people to be getting sick. So protect yourself now.
We're all going to be inside together with a bunch of people. And so if we are still in need of getting vaccinated, is it safe to get both the flu and the COVID vaccine at the same time? There was recent data showing that older people had a higher risk of stroke when they got both the vaccines at the same time.
So what I would say, our recommendation still is to talk to your doctor always, but you can get COVID and flu at the same time. That one study really was about a high dose of flu at the same time as the updated COVID vaccine. And what I would say is it's a signal. It's something we want to study further. And I think it's showing us that, look, we're still studying these vaccines to make sure that they are safe. And look, I want to make sure folks know that I wouldn't recommend something for the American people. I wouldn't recommend for my own family. So my parents who are over 65 vaccinated. I got myself vaccinated. My daughters who are 9 and 11 got them both the updated flu and the updated COVID vaccine. So I hope folks are taking advantage of this time to protect themselves.
And just if they have concerns, they can talk to their doctor and get some clarification on that. One thing that might not make their doctor as accessible is burnout. We see primary care physicians getting burned out, leaving their practice. Pharmacists were on strike. So what is the CDC able to do to prevent or relieve burnout?
Yeah, and look, it's been a hard time across the board for so many during the pandemic and recovering from that. And they do incredible work, our healthcare providers. Actually, the CDC just released some guidelines about how we can support our healthcare workers and in their own well-being and make sure that they are there to care for us. So if you're in your pharmacy today picking up a prescription, say thank you. And just remember that if you are a healthcare worker, to take care of your own wellness, because we need you there to take care of others.
We sure do. I mean, they're important to us at the local level here. I mean, I appreciate you creating this initiative at the national level, but our local healthcare depends on these people, and I can tell they're stressed. As a journalist who hears these stories from them, I know they're stressed.
Yeah, this is hard work. So I want them to hear me say thank you. And so make sure that you're taking care of yourself so you can take care of others.
One more thing that we didn't talk about, because we always talk about, cold, flu, strep, RSV at this time of year, but strep is the one that I was actually wanting to mention. Lots of doctors they're seeing, high amounts of stress and strep, and we know that RSV has been high. And since the pandemic, it's like we get these waves of really big spikes of viruses like that. Are we going to Can we continue to expect that we're going to keep seeing these really big breakouts of viruses like that?
So viruses like to spread. Strep is a bacteria, also likes to spread. What I would want everyone to do is make sure if you get sick and you're feeling sick or your kid is sick, get tested. You need to know what you have. Is it strep? Is it flu? Is it COVID? Because we have treatment. Right. And if you don't get tested, you can't get treatment, particularly if you are older and over 65, really important to get tested because those treatments can save your life,
Yeah.
right? So what I would say is we need to know what you have. So talk with your doctor again, get tested so you can get treatment
As early as possible.
Absolutely.
Dr. Mandy Cohen, thank you for making time to come into our studios. We are honored that you made time for us today, and we hope you have a good rest of your day. I know it's going to be a busy one around Houston.
Thank you. Great to be in Houston.
All right.